Hello, I'm Katie Kim, and I will be doing my topic on lead poisoning. Lead poisoning is basically a common environmental pollutant and potent occupational toxin. It is an environmental hazard and it's capable of causing mental retardation, for example, and it is a non-biodegradable has a non-biodegradable effect, having prolonged persistence in the environment. And human exposure can occur through leaded gasoline or industrial processes. And it is a huge problem in society because more than 1 million children are affected by the amount of lead in their blood, and more than 3 million workers in the US are exposed to lead in the workplace. And according to the World Health Organization, pre-industrial blood levels were zero was 0.016, and later in the 1980s it grew increasingly. And basically, how lead poisoning happened was through working facilities, being exposed to products and equipment with lead, and it highly targeted the central nervous system of children and the peripheral nervous system for adults. And however, the toxins do affect children and fetuses more severely. It affects the developing nervous system because it absorbs a higher fraction of lead, and the lead has access to the brain, causing a lot of disruptions with the development and growth. Public health, basically with the where it is, basically more. It is very highly prevalent in areas of poor communities because poor people are likely to live in these poor areas that are near landfills and polluted sites with aging and deteriorating lead paint, and they have really little influence and political power to force companies to stop the pollution in their environment. And the etiological factors, many occupational workers are very highly exposed on a daily basis, causing lead poisoning to be very likely. And the lead on clothes or from skin can increase the exposure to perhaps children in their homes, bringing in the lead dust. And for future risks for the community, it's important to address and to stop lead poisoning because increased levels of lead poisoning patients and this will cause just unregulated areas of potential toxicity. And how we can solve the problem is through the first, their strategies, and the first I stated was for education and awareness to prevent accidental lead poisoning, to be able to have knowledge of it and to prevent it. And this can occur through the exposure pathways of just how it's exposed and where and from what and who. And the second strategy is stated that increased screening for lead and environmental monitoring and reductive use of lead in paints and other products would be so beneficial. And also, just providing funding for that will allow for more preventative methods and treatments for lead poisoning. And for the future, according to research literature, I found that uh, we need to have more regulation and control on lead paint hazards, and we need to provide care for children and adults with elevated lead levels. And this can be through like the funding and the research on just health preventative methods and treatments, and being able to equip health professionals and agencies in providing this for children and adults. And furthermore, research is so important in providing this. And for a problem that I was able to find was that high cons- there was confusion on whether high concentrations of toxicity, like why is it a problem for some and not have an effect on others. And we do need more evidence and research, and have to explore this in order to provide more preventative benefits for the society and community and the public. And just it's very prevalent. It usually takes only weeks or months for the body to be affected by chronic lead exposure. So it's a very highly prevalent, stressing issue. And my opinions that I included was that we need to examine the effects of lead poisoning in lower income communities with destructed housing and provide funding for them to even be able to have the political influence to change that. And we need also increased research and funding for lead poisoning in order to, just as stated before, we don't even know why some high concentrations affect some and they don't really have an effect on others. And this can be explored through further research that is so needed for the future. Thank you.